Okay, gonna try this again. My last video, I just got turned off on me. Um, Good afternoon again. As I said, my name is Dr. A with Angels Core Care, and I'm a physician, and I specialize in enhancing your health and wellness through medical weight loss, hormone balancing, body sculpting, and addiction medicine to enrich how you feel about yourself and improve your quality of life. If you, I'd like to welcome you to this program. And if you are here live, please type hi in the comments below. That way I know that you're here. And if you are watching the replay, I appreciate you joining us. Please type replay in the comments below. And that way I would know you're here. I'd love to know that you joined us. And I respond to all the comments that are given to me. If you have a question, excuse me, please feel free to type that in the comments as well, and I will do my best to answer your question to the best of my ability. So, my topic today is about obesity and medical weight loss, and in particular, what is obesity and why is it important? Well, two-thirds of Americans are overweight or obese, and those numbers are not getting any smaller. That means two out of every three people could benefit from medical weight loss. In addition, according to the CDC, adults with excess weight are at an even greater risk during the COVID 19 pandemic. And having obesity increases the risk of severe illness from COVID 19. And people who are overweight may also be at an increased risk. And lastly, having obesity may triple your risk of hospitalization due to a COVID 19 infection. So, this is very important. Um, but obesity can be difficult to discuss for several reasons. Mainly there's a lot of stigma that goes along with obesity. Some people are obese and they just don't know it. Some people are obese and they have tried to treat it and they've been successful with that. Some people are obese and they've tried to treat it and they've been unsuccessful with that. And some people are obese, but they're not really in a position to do anything about it. However, like other conditions such as diabetes, high blood pressure, this is a medical condition and it can be managed. So, we talk about what is obesity, and obesity is a medical term. And what happens is your height and your weight are compared, and that's when something is calculated called the BMI or the body mass index. And the BMI is a combination of, again, your height and your weight. And when we look at something like this, someone who has a height of, say, 5'6", and let's say they weighed 150. That puts their BMI just a teeny bit over 25. So a BMI basically less than 25 is considered a normal weight unless somebody is underweight. Now, what if that same 5'6" individual weighed 160? That would put their BMI right there about 26 and a half, which actually falls in the category known as pre-obesity, which again is a BMI between 25 and basically all the way up to 30. But let's say that same individual who's 5'6" hits that 180 mark. That puts their BMI at 30, and that does hit the medical definition of obesity. And again, there's a lot of health consequences that come along with that. Now, the problem with using something like this is it looks at height and weight, and that's all. But as we know, there's other things inside of our body. There's fat, there's muscle, there's water, there's all sorts of things. So when patients come to see me for medical weight loss, instead of just weighing them, we actually do a body composition analysis, which is a pretty cool device where our patients stand on the machine and we enter some information, and it tells us not only their weight, but it tells us how much fat is in their body, how much water is in their body, how much muscle is in their body, what their calculated metabolism is, and it even predicts how much weight they could lose over the course of 6 weeks. So again, instead of just weighing you, this tells more of what's going on in the body, and then it makes it easier to monitor that when you're losing weight safe. And it's also fun to tell patients that they've lost fat along the way. So why is obesity important? As I mentioned earlier, the CDC tells us that adults with excess weight are at a greater risk during the COVID 19 pandemic. And I'm sure we've seen on the news how patients who are obese, they just having a poor prognosis. Um, but in addition to COVID 19, there are many other medical conditions that have an increased risk as well with obesity, such as heart disease, high blood pressure, type 2 diabetes, high cholesterol, hyperglycemia, high triglycerides, heart attack, stroke, premature death, colon cancer, gallbladder disease, prostate cancer. A lot of diseases, the risk goes up with obesity. And we encourage patients to lose weight as if their life depended on it because all of these complications really can be a matter of life and death. Um, now, again, if you have obesity or if you have overweight, know that you are part of the 2/3 of the population that deal with these conditions. But the good news, as this can be treated, as a physician, I've gotten several patients off of their diabetes medicine, their blood pressure medicine, by helping them lose weight. I've had patients who we've been able to get off of their pain medicines because they're losing weight such that their joints no longer have the same kind of pressure on them, which gives them relief and they no longer need to take their pain medication. So, if this information was helpful for you, whether you have obesity or not, or if you've learned something new, please type helpful in the comments below. And also, please share this video with someone else. Someone else may be suffering from obesity or overweight, or really just to educate the population about this medical condition and the complications associated with it. Again, if you or someone you know has obesity or overweight, we're here for you and we can offer treatment that actually works. So you can give our office a call at 614-442-2600, or you can go to our website specifically designed to help with obesity. The website is www.weightloss.prohealthservices.org. Again, that's www.weightloss.prohealthservices.org. And that will give some information about how we can help patients lose weight. So think about what would happen if you were able to eliminate your diabetes medicine or your blood pressure medicine, your cholesterol medicine, or maybe your pain medicine, or you were able to move easier and go up and play with the grandkids or go mountain climbing or all those activities that somehow can be limited because of your mobility. These are all great outcomes of treating medical weight loss. And by being able to do that, ultimately, that could help you feel better about yourself. And that's our goal. So thank you so much for joining me this afternoon. I'll be back next Thursday at 12:30 Eastern Time to continue talking about obesity and different ways of treating that. Look forward to seeing you then. Have a great afternoon.